Well, hello there! My name is Ricky Studwell, and today we're going to be learning about emphysema and bronchitis. Now let's start with emphysema. What is emphysema? Emphysema is the gradual damaging of the air sacs in your lungs, making you progressively more short of breath. Emphysema is one of the several diseases known collectively as chronic obstructive pulmonary disease, known as COPD. In emphysema, the inner walls of the air sacs weaken and eventually rupture, creating one larger airspace instead of many small ones. This reduces the surface area of the lungs, and in turn, the amount of oxygen that reaches your bloodstream. When you exhale, the damaged alveoli don't work properly, and the old air becomes trapped, leaving no room for fresh, oxygen-rich air to enter. The main symptom of emphysema is shortness of breath, which usually begins gradually. Emphysema eventually causes shortness of breath even while you're at rest. Seek immediate medical attention if you are so short of breath you can't climb stairs, your lips or fingernails turn blue or gray with exertion, or you're not mentally alert. The main cause of emphysema is long-term exposure to airborne irritants, including tobacco smoke, marijuana smoke, air pollution, or manufacturing fumes. Rarely, emphysema is caused by an inherited deficiency of protein that protects the elastic structures in the lungs. Factors that increase your risk of developing emphysema include smoking. Emphysema is most likely to develop in cigarette smokers, but cigar and pipe smokers are also susceptible. Also, another risk factor is age. Although lung damage that occurs in emphysema develops gradually, most people with tobacco-related emphysema begin to experience symptoms of the disease between the ages 40 and 60. Other risk factors are exposure to secondhand smoke, occupational exposure to fumes or dust, or exposure to indoor or outdoor pollution. Treatment for emphysema. First off, treatment may only slow the progression of emphysema, but it can't reverse the damage. Doctors may prescribe medications. Depending upon the severity of your symptoms, your doctor might suggest bronchodilators, inhaled steroids, or antibiotics. Some doctors might suggest therapies, such as pulmonary rehabilitation, nutrition therapy, or supplemental oxygen. Also, there are surgeries available as well. Depending on the severity of your emphysema, your doctor may suggest one or more different types of surgery, including lung volume reduction surgery or a lung transplant. Now, let's move on to bronchitis. Bronchitis is an inflammation of the lining of your bronchial tubes, which carry air to and from your lungs. People who have bronchitis often cough up thickened mucus, which can be discolored. Bronchitis may either be acute or chronic. Often developing from a cold or other respiratory infection, acute bronchitis is very common. Chronic bronchitis, a more serious condition, is a constant irritation or inflammation of the lining of the bronchial tubes, often due to smoking. Acute bronchitis usually improves within a few days without lasting effects, although you may continue to cough for weeks. However, if you have repeated bouts of bronchitis, you may have chronic bronchitis, which requires medical attention. Chronic bronchitis is one of the conditions included in the chronic obstructive pulmonary disease known as COPD. For either acute bronchitis or chronic bronchitis, signs and symptoms may include cough, fatigue, shortness of breath, slight fever and chills, chest discomfort, and production of mucus, which can be clear, white, yellowish gray, or green in color. Rarely, it may be streaked with blood. If you have acute bronchitis, you may have a nagging cough that lingers for several weeks after the inflammation resolves. Chronic bronchitis is defined as a productive cough that lasts at least 3 months with recurring bouts occurring for at least 2 consecutive years. If you have chronic bronchitis, you're likely to have periods when your signs and symptoms worsen. At those times, you may have acute bronchitis on top of your chronic bronchitis. Acute bronchitis is usually caused by viruses, typically the same viruses that cause colds and flu. Antibiotics don't kill viruses, so this type of medication isn't useful in most cases of bronchitis. The most common cause of chronic bronchitis is smoking cigarettes. Air pollution and dust or toxic gases in the environment or workspace can also contribute to this condition. Factors that increase your risk of bronchitis include low resistance, exposure to irritants on the job, gastric reflux, and cigarette smoke. People who smoke or who live with a smoker are at higher risk of both acute and chronic bronchitis. It can be difficult to distinguish the signs and symptoms of bronchitis from those of a common cold. During the physical exam, your doctor will use a stethoscope to listen closely to your lungs as you breathe, but other tests may be done as well. Tests like chest x-rays, sputum tests, and pulmonary function tests. Most cases of acute bronchitis resolve without medical treatment in 2 weeks. In some circumstances, your doctor may prescribe medications including antibiotics, cough medicine, or other medications. If you have allergies, asthma, or chronic obstructive pulmonary disease, your doctor may recommend an inhaler and other medications to reduce inflammation and open narrowed passages in your lungs. So there you have it. That's all the info there is to know about emphysema and bronchitis. Thank you for watching and have a great day.